welcome to the Mount Lebanon Minute. I'm Lilley from Mount Lebanon Magazine and the Mount Lebanon Public Information Office, and I'm here today with paramedic Matt Coleman of Medical Rescue Team South. Hi Matt, thanks for joining us today.
Hi, thanks for having us.
Why don't you first tell us what is Medical Rescue Team South and what is the benefit to becoming a member?
Well, Medical Rescue Team South is an ambulance service that covers 6 communities in the South Hills. Mount Lebanon is one of them. It's our busiest area. We have over 4,000 calls to Mount Lebanon out of our average of 9,000 calls a year, and we transport about 3,000 people to the hospital from Mount Lebanon every year. Benefits to becoming a member is oftentimes insurance companies don't cover an entire ambulance bill, and you would not be responsible for any balance that might be remaining on your bill. And additionally, sometimes we go to your house and might do treatment, and you're not actually transported to the hospital. Diabetic emergencies are our #1 cause of that kind of response. A bill would be generated. Your insurance usually doesn't cover that if you're not taken to the hospital, but you would not be responsible for a bill.
I didn't realize that you treat people without necessarily taking
Sure, that happens a lot.
Okay, great. And how is MRTSA funded?
MRTSA is funded primarily through our subscriptions and fees for service. 78% of our $3.2 million budget comes from billing insurance companies. 10% of that additional money is made up through a surplus, a deficit that we have that's covered by the communities that we have, the member communities, all 6 of them.
Okay, great. Now, why should I call an ambulance when I can just drive myself to the hospital? I mean, is it, maybe I'm near the hospital, isn't that just quicker?
Sure. In some cases, it's fine to go yourself. A lot of minor injuries and minor illnesses are fine to go by car. But more serious emergencies, we encourage you to call 911, especially for chest pains and strokes. There's numerous interventions we can provide in the ambulance to ease your pain, to expedite your care at the hospital. We can communicate with physicians en route to the hospital, do EKGs and transmit them electronically. So before you're even there, the hospital knows what's going on.
So they're ready as soon as you roll up, they're ready for you.
Especially with heart attacks, that can expedite your time into a cath lab and allow them to open up blockages that you may or may not have.
And as they say, time is muscle.
That's right, absolutely.
Now, why don't you tell us about some of the new technology here? You guys are always up on the latest equipment. What sorts of things do you have here to help?
The newest piece of technology we have is that all the computers have MDTs in them. That's mobile data transmitters, and they're laptop computers. They're similar to those in the police cars and fire trucks. And whenever a call comes in through 911, the call is displayed on the computer. It provides cross streets to your address. There's map features so that we can find you as quick as possible, and any other additional information that the caller might be telling the 911 operator. Okay. Additionally, with new stuff here, we have new stretchers that hold 700 pounds. As the population's getting larger, that's an increase of 50 pounds from our old stretchers. Okay. And we also have some new turnout gear that's bloodborne pathogen resistant. That's what you might see firefighters wearing for car accidents and things of that nature.
That protects you guys.
Right, exactly. And we got new portable radios for all the staff over the summer. And the turnout gear and the radios were all funded through grant money.
Okay. Now, what should I expect? What should I do to prepare for the ambulance? I've called now. What should I do?
Sure. Well,
and we should say you call 911.
Absolutely. Call 911
first
for any emergency.
Okay.
If you're by yourself, just stay calm and relax. If you're physically able to gather your medicines or any list of medicines that you might have is helpful. If it's nighttime, I turn a light on. It's hard to see addresses sometimes if it's dark out.
That's a good point.
And if you have somebody there with you, they can try to keep you calm, or if you call for someone else, try to keep somebody at ease, and you can gather anything that they may need. Oftentimes people are going to want their insurance cards for the hospital, and definitely that medicine list.
Okay. And Fido, you want to let
Yes,
Fido
yes,
out.
absolutely. Any pets, if you can put them away before we get there, even friendly animals.
They don't understand CPR.
Right, exactly.
You're hurting them. And can I request a particular hospital, or are there certain hospitals that you have to take me to?
Absolutely. Whatever hospital you primarily go to, where your primary care physician is, we're happy to take you. Many people go as far away as Shadyside. We've taken people to Passman and the North Hills. The only thing that prohibits a transport to a certain hospital would be your medical condition. If it's something life-threatening, we take you to the closest hospital. And if it's a stroke or a trauma, we have to take you to the appropriate facility.
Okay. Tell us about some of the community programs you have. You don't just do transport, you have community programs as well.
That's right. We have a car seat program. We have 2 certified car seat technicians that do inspections free of charge. And you can schedule that by appointment using our website or calling the station. Additionally, we have a paramedic, Josh Stewart, who does a program for risky teen behaviors. And we're also a CCAC educational affiliate site, so we have EMT class here, and we had our first paramedic program at Medical Rescue Team South last year.
Fantastic. Well, thank you very much. Again, we want to emphasize emergencies. You need an ambulance, you want an ambulance, 911. If you want more information about other programs or some of the things we've talked about, give a call at the station here at...
Sure. At 412-343-5111.
Thank you very much.
Thanks for having us.